This presentation is on water supply, sanitation and hygiene promotion, or how we like to say WASH. The following presentation provides some of the foundational information and thoughts to WASH in disasters and conflicts. These are largely based on our own field experiences and learning, but all of the ideas presented here are to be challenged and questioned. Similar to all of the other sectors, when planning a response, the context is absolutely crucial. First of all, what is the type of disaster? Is it an earthquake or a flood? Is it likely to be a short-term and temporary response? Or is it a protracted crisis with a large displaced population that will actually need something more maintainable and longer term? Then you need to think through the environment, also looking at the geography, the terrain and the climate, and whether or not it's an urban area or a rural area. And all of these factors should inform your planning and your response. In terms of the affected population, you need to also think through the religions, cultures and traditions of the affected people and how this impacts on their use of water, sanitation and hygiene practices. Also think about what is the general state of health of the population before the disaster or conflict erupted. Then you need to also look at the security. Is it safe to deliver a response? If there has been a big earthquake, there may be many aftershocks and buildings and bridges may be unstable. Equally, if it's in an area of conflict, then you may even need to negotiate your access. You need to examine and understand the politics and stakeholders involved in water at both local and national levels. Conflicts can quickly erupt over water rights, access issues, and the use and selection of water companies. And all of these issues must be thought through and used to inform how you design and implement an effective WASH response. In terms of a very typical WASH response, to a disaster situation, usually during the immediate disaster phase, you'll be looking at how you can very quickly truck in clean water supplies to the affected populations. Once you have that established, if something further is needed, then usually in rural areas you look to establish shallow wells with a series of communal latrines or latrines for a number of households to share. Usually accompanying those, organisations and agencies will train water committees, and depending on what year the water committee was established or the country it is in, will also determine its name. So for instance, in Somalia you will find water and environmental sanitation committees called WES committees. In other countries they've been called WATSAN committees. And then you have WASH committees, and all of these are usually accompanied by hygiene training as well. If you want more information on the minimum requirements, the Sphere Handbook comprises the minimum standards, key actions, indicators and guidance notes in a disaster response for each sector. For the WASH sector, it includes water supply, hygiene promotion, excreta disposal, vector control and solid waste management and drainage. So you can go to the Sphere Handbook for very specific minimum standards. You can all easily access and read about the general facts and figures surrounding WASH. So rather than cover those, the remainder of this presentation brings in a number of case studies to hopefully offer some insight into WASH and different disasters and conflicts. So this slide covers South Sudan. And most of the UN and INGOs responding in South Sudan, both before the 2005 peace agreement and after, followed the typical approach that we just heard. So to go through the photographs on this slide, the bottom right one is a typical shallow well water pump. So there's a fence surrounding it to keep animals and livestock out. The water committee there have their wellies and hats on that were typically given to members of water committees. The top right photograph is one of a hygiene promotion team delivering a drama training session. The central photograph is one of a male and female latrine. And following both before the 2005 peace agreement and after, between the North and the South, thousands of shallow wells were constructed, and every water point had a WES committee trained with a mix of men and women in each. There were drama groups that went around hygiene promotion and hygiene training, and plays for good sanitation. And there was also teaching in schools of good sanitation. And all new water points were initially well looked after and cleaned by the WES committees. And most water points had a trained mechanic that would be a member of the community who had been selected for the specialist training, so they knew how to fix the wells. There were a few major flaws in all of these works. Firstly, the climate and rainy season in South Sudan meant that usually after every 6 months most wells would break down. And whilst the mechanics knew how to fix these, they had no money for the spare parts, or to purchase spare parts, and there was no payment mechanisms in place. And you could argue that people have no money, but ultimately every 6 months when they broke, the communities would have to go back to the humanitarian agencies each time, requesting support to rehabilitate these shallow wells. And in many cases, these actually made the communities more vulnerable, because women and young girls would often go and spend a lot of time walking to water sources, and through this and doing that regularly, they had a good understanding of which water sources were low, which ones were reliable. But the moment they'd stopped doing that and started using a shallow well for 6 months, they'd lost that connection and that network. And so then they had to start from the beginning trying to figure out which of the water sources were not contaminated and which were had sufficient quantities of water in. Similarly, most of the latrines were not used, and that was for a number of reasons. Ultimately, this was a major behavioural change for most South Sudanese at the time, as they'd not used latrines before, and very much of them saw it as a requirement or condition from outside agencies to actually use to get aid or to get the water point constructed. The most of them, local communities could discuss the hygiene messages and the importance of using a latrine around reducing disease outbreaks, but ultimately they thought their way was much more better at that time and much more convenient. And there was a consensus in South Sudan that behavioural change would take at least an entire generation. In some cases, when people are completely displaced as refugees into an established refugee camp, they can actually adapt a lot faster to using latrines, as there are fewer alternatives available. Whereas if you remain at your home or in your more common environment, then introducing behavioural change can often appear more challenging. Now, South Sudan is now littered with dysfunctional shallow wells and unused latrines. Officially, 67% of the population of South Sudan, both urban and rural, have access to improved drinking water sources. However, the Ministry of Water, Resources and Irrigation states that around 35 to 50% of water facilities are non-functional at any point in time in South Sudan. And so the actual level of access to an improved water source in rural areas is estimated to be only actually 34%, which affects most of the country, as over 80% live in rural areas, and that represents 90% of those living in poverty. The next case study we move on to is Liberia. During 2007, again, once a peace agreement was reached, there was a major return and reintegration program in Liberia, which saw thousands of trucks, UNHCR trucks, bringing home many people from all of the surrounding countries where they'd taken refuge from Liberia. Many of the UN and INGOs had began undertaking shelter projects because many of the houses and communities had been completely destroyed. And together with these, they'd taken on a number of water and sanitation programs. The top right photograph is of a local team constructing a water well. And the bottom right photograph shows you a latrine, a male and a female latrine. And at the time, most organisations would paint their projects in their colours or their logo colours. So you can probably guess which organisation those latrines belong to. And so these are scattered throughout rural Liberia. And I went to Liberia in 2007 to undertake an evaluation of a number of water and sanitation programs that had been funded by the Norwegian Ministry of Foreign Affairs. And anybody that knows latrines, even latrines that are well kept and well maintained and cleaned, you can usually tell when they're being used. And it became obvious to me very quickly that actually none of the latrines were in use. And at first, a number of organisations tried to say that they are used, they're just very, very well cleaned. And once we'd established this was not the case, I needed to find out what was going on. And in the end, I managed to have a series of discussions with different groups of women. And then I found out from the women that they believed that if you use the latrine in rural Liberia, that you catch HIV/AIDS. And so none of them would use them. In response to this, a number of the organisations then paid a number of people, they got a number of people with HIV/AIDS to come and talk to these women's groups to try and tell them how they contracted HIV/AIDS and how it's not through the use of latrines. However, when these people with HIV/AIDS were leaving, the organisations had paid their transport and their food, and so the women's groups seen them handing over money, and so they thought they'd just been paid to tell them that. So it became a major challenge in terms of trying to get rid of that myth in Liberia at that time. Now, if we look at Somalia. This is in Puntland, Somalia, northeastern, the coastline. This was the coastline that was affected by the 2004 big Asian tsunami, which contaminated many water sources, destroyed houses and fishing nets and fishing boats, all up and down this area of coastline. What it also did was something quite interesting as well, because for many, many years, Somali fishermen had complained and said that there was illegal dumping of nuclear and toxic waste in their waters. The international community had said this was not the case, and there was equally no proof for this. With the 2004 tsunami, also washed up onto the shores were the nuclear and toxic waste barrels, and it was quite timely that because of the tsunami, the United Nations Environment Programme were there taking photographs with a series of journalists, so therefore it all became very well documented. Anyway, there was a needs assessment conducted in most of these areas, and it was actually found that water was a priority for most of these communities because most of their water sources were contaminated, and they weren't, whilst many of the other organisations were supplying fishing boats and fishing nets, this was not actually the priority for many of the communities, as they weren't ready to go back and fish just then. They actually just wanted to make sure that they had enough water to drink. In a town called Bendabela, we met with the village leaders and elders and a series of religious leaders to discuss what the water response should be in their town. And we agreed that a diesel-generated water system was needed with several water points throughout the town. The community themselves agreed on a payment structure where each household would contribute a certain amount of money. Mosques and schools would get free water, and a selection of households identified as vulnerable would also get free water. As this was happening, we also held a workshop with local elders and religious leaders to discuss and explore the sanitation and hygiene in water through the Quran. And if you know Somalia, then you know the Quran is the way of life in Somalia, and you completely live your life according to the Quran. And so we ran this workshop, and the results were very powerful, as it was agreed that things like using a latrine and maintaining excellent sanitation and hygiene practices were paramount to the Quran. And so these findings were then put together with a number of local trainers that had been involved throughout the workshop. And then the local trainers, together with the religious leaders, went and preached and delivered these messages to the local communities. We had funding to build a number of latrines, and we constructed these using all local materials and local labour. And we also ensured that the community had the skills themselves to know how to maintain and build these. As we worked on this programme, the community themselves went on and built household latrines. So after about 6 months, most households in this town had at least one latrine, and more importantly, they were being used and cleaned daily. Now, instead of, as in the case of South Sudan, where we understood that behavioural change can take generations, this was the first time I saw behavioural change being instant. And the reason it was instant is because it was not a request from an outside agency or outside people. It was more that it was completely embedded in the Quran, and it was seen as being part of Somali life now. Then we also discussed the need for a water and sanitation committee, and it was agreed there should be one, and the elders agreed that as women mostly use and collect the water, that there should be both men and women on the committee. They decided that women should teach other women on hygiene issues and that men should teach other men on hygiene issues. They also agreed that men should be the trained technical people to maintain the water system. And they agreed that women should be the ones to care for the money collected, as in these communities it was believed that women could be trusted most with money. From this there were clear gender roles and divisions, but we saw this as a major achievement. Before this, men and women didn't even have shared community discussions. And now there was an established joint committee that met regularly, and because of the clear divisions, women had very clear decision-making powers. The elders also got to see how well organised and effective women were, which meant that they started involving women in more discussions around other topics. It wasn't our role to go in and to try and dictate how men and women should all be equal, especially during a humanitarian response, but rather we found a way to try and work together and to use it as an opportunity to explore some ways of working together that would be accepted and promoted within the community. Just to briefly look at an urban response in a disaster situation, the water and sanitation systems in urban areas and low and middle income countries are fragmented, and the levels of service do vary widely. And there are a multiplicity of local actors, including public and private actors, from small vendors to large haulage companies. If the disaster is in the urban area itself, where there was functioning water and sanitation systems before, then once you've done the immediate getting the water trucking in, then it's about how you fix and re-establish the water infrastructure and the sewerage systems to get the sanitation facilities functioning again. If it's the case that refugees and IDPs have come into the urban area, then you need to understand the capacity of the water and sewerage systems and how these can be strengthened or extended to meet the increased demand. Then you need to manage the use of water and ensure that conflicts don't begin to erupt over water usage. Because water rights and who has access to the water can be extremely controversial. And then you also need to look at the local water bodies and ensure that any rivers or canals are not contaminated or overused. For yourselves, when you're thinking through about planning a response, these are some of the core criteria to try and think through to help inform the planning and implementation of your response. Firstly, relevance inappropriateness. For sanitation and hygiene practices that involve a behavioural change, to me, the key is finding out what matters to that local population, and then making that the core of the core reasoning behind the changes. So sometimes improved health is enough to motivate people to change their behaviours. Otherwise, it can be about finding how it links to local religions and traditions. Sometimes in other areas, I've seen it work where we found what you would class as the local celebrities and elites to set the example, and so other people want to copy them. Efficiency, look at your supply chain and your logistics. We originally flew water points and equipment and pumps in from Nairobi into Somalia, but these would often arrive damaged because the aircrew transporting them didn't know how to load them and unload them off the aircraft. And when we actually reviewed it, we could have them shipped in at a much cheaper cost. So always looking at your supply chain and what different options are available. Effectiveness, I mean, you can look at the Liberia example with the latrines to think through an example there where something was not well thought through around its effectiveness. But then also, if you're going to do anything around shallow wells or even boreholes, you need to know how far you need to dig to reach the right quality of water. I've visited many shallow wells that are not used because they still only reach poor water quality or water that tastes very salty or not sufficient quantities of water. Coherence. Anything you do should match up to local priorities and national priorities. And to look for coherence amongst all of the stakeholders involved. Impact. Make sure sanitation facilities will not contaminate water sources. Also, is the water table underground at a sustainable level? Granted, in an emergency phase, it's not always possible to do this sort of research, but just be aware of it because that information or data might be available, particularly in areas of increasing drought or desertification. And then sustainability. For water provision, it has to be maintainable, not erode traditional coping mechanisms. And you have to find a way, particularly in protracted crises, countries like Somalia, Afghanistan, Sudan. There has to be some form of payment mechanism in place wherever you're going to involve any equipment that needs regular maintenance or that may break down. I hope you've enjoyed listening to this presentation. I'd very much welcome your thoughts, your questions. If you disagree with anything I've said, then please let me know. I'm welcome to that as well. Thank you.